So I think that pain management actually starts at the time of surgery. I perform several types of blocks to ensure that you're very comfortable when you wake up. But in the post-op period, I'll give you medications that can help control your pain and some undergarments that help support you through the process. We recommend that after surgery you wear a scrotal support with your penis upwards, so pointing towards your belly button during the recovery period. It's also helpful to use ice, so icing every 30 minutes in the recovery period to help with swelling. So we recommend that you can start showering about 48 hours after surgery, but don't treat the incision site special. So let the water and soap run over it and just pat it dry. We recommend that you don't scrub it. So everybody's different in the recovery period. And for some men, they're a little bit swollen after surgery. So as far as timing for when you should start pulling down the pump, it's quite variable. But for most guys, I recommend 3 to 5 days after surgery to start pulling your pump down in the scrotum several times a day. And it's important that you wash your hands before doing this. I recommend drinking lots of water, getting a lot of fiber in your diet, and over-the-counter stool softeners to avoid constipation after surgery. So I recommend no heavy lifting for 4 weeks. And I also recommend no bathing, hot tubs, saunas, pools, or even soaking in the tub for about 4 weeks as well. Other movements are fine, so getting in and out of a car, going up and down stairs, but nothing too strenuous. So for most men, after about a week after surgery, you can return to work and start driving. For driving, it sort of depends if you're still taking narcotic medications though. So if you've transitioned to only ibuprofen or Tylenol for your pain control, then it's safe to drive. Most men will need a full week to recover, but by 2 weeks, most guys are also back to normal activities. So anything that's bothering you, I'd like to hear about. But generally, things that are concerning are fever, swelling, redness, or fluid coming out of the incision. After surgery, I'll see you back at around 4 weeks, and we'll go over how to inflate the device. After that, it kind of depends on you. If you want to come back again, we can go over this again, but for a lot of guys, that's all you need. While there are exceptions, for most men I recommend waiting about 6 weeks after surgery before using the device for intercourse. Please call our office if you have any concerns during the recovery period. Happy to discuss and answer any questions that you might have.